Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about ankylosing spondylitis. It's a chronic progressive inflammatory disease of sacroiliac joint and the axial skeleton. This head, neck, ribs, vertebra. So causes why this ankylosing spondylitis occurs means unknown. First it is unknown. Next it's by people who have gene HLA-B27 are a great risk. It is strongly associated with HLA-B27 genetic marker, so 80% of them, and commonly in young adults, males. Okay. Now pathology. Initially there will be inflammation of joints. Inflammation of joints is followed by synovitis, arthritis and cartilage destruction, fibrosis, and later bony ankylosis, like bony fused type of bony ankylosis. The joint commonly affected are the sacroiliac joints, spine, hip, knee, okay, and manubrious sternum. Now what are the clinical features, signs and symptoms? Means the patient usually complain early morning stiffness and pain in the back. Now on examination his stiff spine is seen. Test for the sacroiliac joint is positive. Next is cervical. To know whether cervical spine also is in neck muscle, cervical spine also is involved means the patient is asked to touch the wall backside with the back of the head without raising his chin. Okay, this is Fletcher's test. Now next one, to see the thoracic spine involvement, we need to see if the chest expansion is less than 5 centimeters. So there is involvement of thoracic spine is suspected. Now investment in lab test, we'll understand that there will be raised of HLA-B27, ESR, CRP, ANA, increased lymphocytes. Now in X-ray of SI joints shows haziness, subchondral erosion, sclerosis, and widening of SI joints. An X-ray of spine shows squaring of vertebra, loss of lumbar lordosis, classification of anterior longitudinal ligaments, bringing osteophytes and bamboo spine. This is now treatment. Firstly, conservative physiotherapy management, surgical treatment. Conservative means rest, NSAIDs, indomethacin, and physiotherapy means back exercises, etc. Surgical treatment, in this radiotherapy also helps. And surgical treatment consisting of spinal osteotomy to correct spinal deformities, total hip replacement, knee replacement for hip and knee ankylosis. Okay. See, starting physiotherapy management, measures to relieve pain and spasm, we need to give cryotherapy, ice therapy, thermotherapy, heat therapy for relieving pain. Next, pool therapy, water therapy. Now measures to improve spine mobility, flexibility means repeated flexion and extension, rotation exercise of spine along with small range mobilization is in spine is done. Next, breathing exercises. How to improve breathing means deep breathing exercises to improve the vital capacity of lungs, so that to improve the breathing capacity, localized thoracic breathing is encouraged. Next, measures to improve muscle power, active ROM exercise, passive ROM exercise for the spine, hip and other joints to improve joint mobility and power. See, first one is leg lift. Here see, leg lift. Lift one leg straight off the ground, hold for count of 10, then repeat with other leg. Next, heel press. See, in a supine position with the knees slightly bent, press the bed with your heels and count 10. Next, sitting leg flex. Here leg must be flexion. Sit on a bed or ground with the back supported. Try to strengthen your knees and press them down against the bed or floor while gradually dorsiflexing with your ankle joint. Hold and count 10. Next, forearm push. Push your forearm against the resistance offered by your other hand and reverse and repeat. Next, hip stretch. In the supine position with one leg straight, bend the other knee towards the chest. Count for 10 and then repeat with other leg. He sat on the chair and keeping your leg on the stool. Now gradually straighten the leg with pushing the knee downwards. Next, heel to toe stretch and knee bend. These all need to do. Next, to improve posture, good posture and body ergonomics are to be maintained. So posture leading to deformities mentioned earlier should be strictly discouraged. Shin should be tucked in. Repeated prone lying to prevent hip flexion, contractions and dorsal kyphosis. Hip hypertension is prone. Avoid stooping posture. Bracing is useful. Avoid use of spinal support for long time. Avoid prolonged bed rest. Swimming is encouraged, particularly front crawl. Group treatment, pool helps. Okay, followed surgeries like THR, osteotomy of spine, physiotherapy measures should be followed. Okay, I hope you understood this topic. Thank you for watching this video.